Today I'm meeting with Dr. Broadbent. He is going to be performing my oral surgery. It is a pre-op appointment, so he is going to let me know what to expect, how to prepare, go over pain management, and let me ask any questions that I may have. And there will also be a CT scan to make sure that nothing has changed from my last appointment.
What my plan is,
Okay.
and then talk about like pain control afterwards and all those kind of things and kind of what to expect. Okay. Before you go, we're going to get a CT just so I can plan a few things out. We'll have the anesthesia provider will be there, so they'll put you all the way to sleep, and then I'll get the surgery done. Probably going to take about 3 hours, 2 to 3 hours, somewhere in that range is what the anesthesia will be. And then you'll kind of be in the office for a while afterwards and waking up and all that. And then once things look good, we'll let you go home. All the sutures are dissolvable that we'll put in there. They usually fall out about 3 to 10 days later. Depending on how stable the implants are, different things where I can get them. If I can, I'll try to put on what are called healing abutments. So you'll see these little caps that just barely come through the gum tissue. Sometimes if the implant isn't as stable as I want it, or I have to graft a little bit or do something like that, then I'll actually suture over the top of it so you won't see anything coming through. And then that means that at that 3-month phase, we do have to uncover those implants just with a real minor procedure. Let's see, pain control afterwards. So you'll be numb, okay, so when you wake up, you won't have any pain. And then ibuprofen, Tylenol. What have you normally done in the past for pain control?
Okay. She'll be pretty sore and painful, like on the ride home.
No, really, it shouldn't be too bad because we're going to have it be numb.
Okay.
So and not only that, but the anesthesia, the local anesthesia that we use when we put you to sleep, or after your sleep, will numb up your whole mouth. The first day with the anesthesia, you're not super hungry. I'm more worried about your hydration. In my mind, it's better to be hydrated than get tons of food in for the first day.
There's some recipes and just implant stuff too, so things for you to go look over.
Okay.
Did you already get one of those?
No.
Okay. There's lots of things in there.
Okay, yeah. It's foods, just mostly.
Yeah, so pretty much scrambled eggs, mashed potatoes, pancakes, fish. Fish is really good, you could have pastas. You kind of mush them up with a fork, puree things. I've had people do all sorts of crazy stuff. So. Big Mac and French fries in the blender.
And I guess my question with that was, is it beneficial to buy like some type of supplement shakes?
I think the Ensure shakes and those types of things are great. Yeah, especially for the first few days.
What kind of mouth rinse?
We do. I'll give you one called Paradex or chlorhexidine. It will have you start using 24 hours after. And you just use that for about 10 days to 2 weeks, and it just kind of helps keep things clean.
No regular mouthwash?
No, not for the first couple of weeks. We'll put the dentures in, before you leave. Just rinse them off really good with water, brush them. You can use toothpaste or whatever, and then just wash them off and let them air dry. If you can lay low Saturday, Sunday, Monday, I think you'll most likely be okay to get back to work on Tuesday. I usually like to see about 10 days to 2 weeks after. And then if everything looks good and you're doing really well, then I usually see it at 3 months. If you have any other questions, what I would say is just write them down, and then bring them in on the surgery day and we can talk more about them. We'll kind of give you updates as to how things are going along, during the procedure. Usually, we got all the teeth out, great, we're replacing the implants now, and got bottom jaws done, top jaws, we're working on those kind of things.